Okay, thank you very much. Maybe just, that's it. Can you see that then? So, thank you for coming again. Oh, I need this thing. So this is something that I've been thinking about, and it's probably the most, in my university, it's the most one of the most controversial things I talk about. In fact, I talked about it once in a lecture, and then I wasn't ever allowed to say it again. The students liked it, but the staff hated it. Right. So, and they wouldn't let me give it again. So now I only give it where I get the chance. So everybody will have heard of the Global Burden of Disease project. This lecture is based about a paper that I wrote about it. And basically what I was trying to say, I tried to put it very nicely in the paper. But the main part of the argument is that it's a complete waste of time. And the world would have been better off had it never been done. That's basically the argument. But I want to go through the steps of that argument. So, the big idea with the Global Burden of Disease study is that if we could add up all of the suffering in the world, if we could sort of get a measure of, if we could count all of the ill health in the world, then that would help decision makers, researchers, and citizens understand what the most important problems are, right? And then you could compare health across communities and over time, and you could guide assessment of where health information systems are weak by identifying data sources required for burden calculation that are missing. So basically that one is these are the two reasons, and that's another one, but that one's only valid if these two are worthwhile, because that's saying, right, okay, if we could work out disease burden, we could find out where we need information to work out disease burden that we don't have. So it's basically helping decision makers, researchers, and citizens understand what the most important problems are. But what does that mean? Most important. What does most important mean? I mean, what's the most important health problem in the world? Do you think? What would you think the most important health problem is, and why? Sorry to pick on you. You just had a nice bright pink pencil case that attracted my attention, and she hides it under the table. Glasses case. Oh well, it's even better then.
I guess it's infectious disease.
Why do you think infectious disease are the most important problem? It's curable. All right, that's interesting. What about you? What do you think is the most important problem? Heart disease. Why do you think that's the most important problem?
The most frequent.
It's the most frequent. Okay. Well, I think the thing is, I think this is a bit vague. What most important is it's a little bit vague. This is what important people in leading global health positions say about the Global Burden of Disease study and why they think it's important. So the Director General of the WHO says, accurate assessment of the global, regional and country health situation and trends is critical for evidence-based decision making. Okay. Which is interesting because we've been doing public health for a long time before we had it. But now it's become critical. The editor of The Lancet said, an important contributor to our understanding of present and future health priorities. Right? It's saying what the most important are. These are our priorities. So that, if we add up all the burden of disease in the world, cardiovascular disease might be the number one. So that's where we should be putting our efforts. That's our priority, cardiovascular disease, because it's the most frequent health problem. And the Global Burden of Disease study challenges us to be rigorous and clear in our arguments about the criteria that should be used to guide programming investment decisions. That's the president of the World Bank. So the president of the World Bank thinks we should decide where our money goes on the basis of global burden of disease calculations. Now that's a really big worry, I think. There's one person, the global burden, this is Richard Horton writing in The Lancet, the global burden of disease has recently been called by one professor of epidemiology a public health disaster. And that professor of epidemiology is me. Right? So I'm one of the few people who think that it's all a complete waste of time, right? And so and that's my job is to convince you that it's a waste of time, or to be convinced by you that it's not a waste of time. Either of those is good. So this is what you see a lot of in global burden of disease study calculations. It's like sort of when I was a kid, my favorite television program was Top of the Pops, right? It was like a music show, and everything was coming up, and this particular band was now number one, and somebody else was number three, and this is like Top of the Pops of disease, right? So ischemic heart disease, you were right. Ischemic heart disease is number one, right? And HIV is number 5, but HIV is going down. No, HIV is going up. Low back pain is going up. Malaria is staying where it is. Different problems. I did a lot of work on injury control, and I remember saying to Etienne Krug at the WHO Health Organization, and I said, how's it all working out with this global burden of disease study and injury? And it says, it's quite good. And I said, what do you mean it's quite good? He said, injury's gone up. What? How can anybody say that? It's quite good because injury's gone up. And it was good because the funding they get for their little empires is related to disease burden. People who are interested in mental health are really excited because mental health is really going to the number one. By something like by 2020 or something like that, mental health will be number 2 or number 1. Depression is the most important health problem in the world, and perhaps we should spend all our money on it. So these things going up and down, I think it's all very strange, and I don't think this is a very when you have people who work in the WHO who are saying things like it's good, injury is good because we're going up, I think we've got a problem, and it really works its way. People go, right, what's the most common problem in the world? Oh, that's the problem we should be spending more money on. So this is Richard Horton writing in The Lancet again. He's saying in 2010, the total amount of funding in the world for health was 28 billion. Given that non-communicable diseases account for 2/3 of it, how much of that money do you think is dedicated to these diseases? Only 5%, right? So, if he's thinking cardiovascular disease and chronic disease, 2/3 of the burden, they should get 2/3 of the money. And if it's not, there's something wrong. And you get after the global burden of disease study, you get lots of different papers calling, it's like sort of burden envy. It's like the mental health people said, oh, there's no health without mental health. Our problem is the biggest problem in the world. And then, the maternal and child undernutrition people said, no, this is the biggest problem in the world. And then the chronic disease people say, we've got the biggest problem in the world. And that's what universities and schools of public health are like. You've got these little, it's like these little kingdoms built around diseases, right? And everybody's fighting to have the biggest disease burden, and it's very strange.